I'm Mary Parker, and welcome to Charles River's vlog series, where we spotlight researchers who take advantage of our research model services. Anne M. Fink's laboratory uses rat models to study sleep and circadian rhythm disorders. She received her PhD from the University of Illinois Chicago, where she focused on investigating the autonomic nervous system and sleep neurobiology. Her laboratory's preclinical research informs the management of a variety of prevalent health conditions, including hypertension, shift work sleep disorder, sleep apnea, and insomnia. Welcome, Dr. Fink.
Thank you.
So, why is it important to study the consequences of inadequate sleep?
These health problems are so prevalent. More than 50 million people in the United States have sleep problems, such as sleep apnea and insomnia. And these conditions shorten your sleep and they also fragment your sleep, which means people with these conditions are sleeping usually less than 6 hours a night, and they're frequently waking up throughout their sleep period. That's a big problem because it disrupts the nervous system in ways that lead them to develop heart disease and hypertension. That's very serious because it can lead to stroke and death.
Yeah, I do understand that it can be a really prevalent problem, especially when considering factors like stress, which may have been increased during the pandemic.
Right, certainly. Some data show that people were sleeping longer during the pandemic, which is a good thing. But like you mentioned, stress can also disrupt your sleep and cause those frequent awakenings that appear to have very detrimental effects on the cardiovascular system.
Absolutely. So, how do you use rat models to investigate the sleep related problems that afflict humans?
So the rat represents an excellent model for studying sleep. Rats spend a lot of time sleeping, especially in a laboratory setting. We can also do more invasive and long term testing in rats than what would be possible in humans. So, as you can imagine, it's very difficult to bring humans into a sleep laboratory and to control all of the confounding variables and to measure their sleep for long periods of time. But in rats, we can implement transmitters that will allow us to record sleep for months. Sometimes even, almost all of the rats' entire life, we can get data on their sleep. And in addition to that, we can study their blood pressure and heart rate. And we examine variability in those signals and correlate them with the different stages of sleep. And that helps us understand how these diseases develop.
You mentioned being able to do this throughout the rat's lifespan. Can you then do any kind of studies related to aging and sleep issues?
Yes, and there's a great interest there because we know as people age, their sleep becomes less restorative. They're more likely to have sleep problems like sleep apnea and insomnia. So we can investigate those problems using rat models. And then we can also test interventions too,
Yeah,
like different
that's
therapies, different drugs. My lab is particularly interested in circadian rhythms, so we want to understand how sleep at different times of the day and night has a differential effect on cardiovascular risk factors.
so. What are you discovering? How does inadequate sleep affect the body?
So we found that when rats have insufficient sleep, or if we interrupted their sleep all throughout the day and night, they develop high blood pressure and their blood pressure stays elevated. So they become chronically hypertensive. And we found that the bacteria that live in the animal's intestines play an important role in this. One of the things that we found is that the bacterial content of the intestines shifts toward more pathogenic, more undesirable bacteria. And those bacteria release metabolites that affect the cardiovascular system. For example, some of those metabolites might be um, pro inflammatory, they might also be prothrombotic, indicating that they could lead to blood to clot more, which could lead to stroke. So we think that these bacteria in the gastrointestinal system play a really important role between this link between poor sleep and future cardiovascular diseases.
So you're basically saying that the gut microbiome can affect sleep, or vice versa, or both.
Probably vice versa and both. But yes, our data show that the gut microbiome is affected by sleep and in turn affects cardiovascular health.
Wow. So, how do you expect your preclinical research to improve public health?
Well, we're doing more studies now to understand the specific bacterial profiles that are associated with the development of high blood pressure. And if we can understand those profiles and the metabolites that are released into the circulation by those bacteria, we could design therapies that would prevent the development of high blood pressure. And in doing so, we could then probably reduce outcomes related to stroke and heart disease. So in the future, these will probably translate into probiotic or prebiotic therapies that people could take if they have a high risk for cardiovascular disease, and that would therefore be cardioprotective. My laboratory is particularly interested in the detrimental effects of shift work or any kind of condition that causes people to stay awake at night and get their sleep during the day. So shift workers would be one area, or one group of people rather, that we would be interested in targeting. Because of course, they have a situation where their sleep is going to be disrupted simply by the fact that they're awake all night and then trying to get sleep during the day. If we can make a therapy that protects them, perhaps like a probiotic or a prebiotic supplement that they could take, I think that would be a really important way to reduce cardiovascular disease rates in the US.
Yeah, that does sound really promising. Would that type of research also translate to people like, say, international pilots who have to be up for long periods of time, or soldiers, people like that?
Right, those are excellent examples because those are people who have to be awake and alert for sustained periods of time. So I think our therapies in the future could not only reduce their risk of developing cardiovascular disease, but could also improve alertness and the quality of their sleep when they're off duty.
Okay. And what have you found in your lab are some of the strengths and weaknesses of translating the rat models of sleep into humans?
Yeah, I think some of the strengths are certainly that the signals that we measure are very similar in the rat brain compared with the sleep signals that you would measure in a human. And strengths there as well include, like I mentioned before, the ability to have long-term monitoring. So on the slide that I provided, you can see some of the examples of the signals that we measure, such as the brain activity and muscle activity that allow us to determine when an animal's in REM sleep versus non-REM sleep versus awake. And then we can correlate breathing and blood pressure and heart rate related variables to that. So those are strengths. Weaknesses are that there are some differences in the microbiome between animal models and human models. And it becomes even more complicated because those factors are affected by so many things, not just sleep, but also the way that um, we live our lives. Like what we eat has a significant effect on the microbiome. Our genetics, all sorts of health related behaviors affect the microbiome. So those studies in humans become incredibly complicated. In rats, you can control more variables, which allows you to do um, more precise, reliable research. However, like you mentioned, there's the concern that the rat microbiome is not going to be exactly the same as the humans. So it truly is a research model that then has to be tested in human populations.
The nice thing about it, I guess, is the rat is so very flexible. Can be used for at least helping us get a baseline to understand, to build off of the human model.
Correct. And we can control their diet, we can control genetic factors. In some studies that we're interested in doing in the future, we can compare male and female animals. And of course, you can do all those things in people, but it's just much more difficult to control dietary factors and the environment in a clinical study.
Of course. Well, thank you so much for joining us and for sharing your lab's research. It really does sound fascinating.
Thank you. Thank you for having me.